A plan that is needlessly rushed is a plan that will needlessly fail.
Now at 6, treading lightly down the road to reopening. The new tri-state plan in the works. But what needs to be done first? And miracle workers in New Jersey, the blessing just bestowed upon a church that ran out of food for struggling families. Thanks for joining us. I'm Chuck Scarborough.
And I'm Natalie Pascarella. In the state of New York, all major indicators are down. But new state data shows that nearly 15% of New Yorkers tested for antibodies had the virus. So this suggests 10 times as many had it than what was reported. It's higher in New York City. At least 25% might have had the virus. New York State's pause order expires on May 15th, and some areas could reopen, likely those in the upstate area. In the city, plans are in the works to open 40 miles of streets for pedestrians, with the goal to open 100 miles in the end there. A new self-swab tests will increase testing, and 1,000 contact tracers are being hired. In the state of New Jersey, the stay-at-home order isn't going anywhere for now, but Governor Murphy did lay out a 6-point plan to reopen. This requires 2 weeks of declines, widespread testing, and extensive contact tracing. And all of this comes as the tri-state inches closer to 500,000 total cases. 25,345 people have died in the tri-state in this pandemic so far. News 4's Andrew Siff live on the Upper West Side tonight with the cautious walk to recovery here in New York. Andrew.
Right, Natalie, the big challenge is if you start to reopen the economy and parts of society, but you still tell people that they have to socially distance, the challenge is how will New Yorkers have enough elbow room? So after resisting the idea of open streets for weeks, today Mayor de Blasio reversed himself, embracing a city council plan to shut roads like this one, like Central Park West, certainly those that are adjacent to parks. The road to reopening now includes more room to roam for New Yorkers. The city planning to designate 40 miles of streets near parks, closed to cars, but open as socially distant walking spaces.
The streets adjacent to parks are an obvious opportunity to open up more space, so we're going to work together to figure out how to do that.
Finding a way to move around safely becomes a bigger challenge as the state gets ready to gradually end restrictions.
We're going to turn the valve on reopening. Turn it a little bit, start to reopen, and then you watch the dials.
The key metric, hospitalizations, now down to only 122 new admissions in the city. But the governor worried enough about a surge this fall, he wants the Javits Center and other sites to stay ready as backup hospitals.
I want to get tested because I'm at high risk.
Miguel Colon of the Bronx braving a long line for a COVID-19 test at the Gotham Health Center today.
My concern is that they don't know how to pinpoint where it's coming from.
But the city will now hire 1,000 contact tracers, essentially disease detectives, to track down where people got their infections. The city also trying to speed the testing process by moving to self-swab.
The patient takes something that's basically a sterile Q-tip, puts that in their nose. They don't have to go way deep, just enough to get a sample. They, forgive my bluntness, they spit into a cup.
As for what a reopened city may look like, I asked the mayor if he'll help restaurants come back by converting them into outdoor cafes.
Are you considering assisting restaurants by closing some of the streets like 9th Avenue?
I think that's a very interesting idea. There's something appealing about shifting more of the activity outdoors and adjusting accordingly.
As for the streets plan, the mayor's office did not get specific today, but did say it would be at least 40 miles of roads that are closed to cars and open to pedestrians, with the goal of opening 100 miles to pedestrians while this crisis is going on. We're live on the Upper West Side. Andrew Siff, News 4 New York.
All right, Andrew, thanks for the latest there. Well, we have a sad story to report tonight. One of New York City's top emergency room doctors has died by suicide after treating COVID-19 patients. This is according to a report from the New York Times. Dr. Lorna Breen was the medical director of the ER at New York Presbyterian Allen Hospital. Her father told NBC News the 49-year-old doctor contracted COVID-19 while treating patients. She recovered, then went back to work. But the Times reports the hospital sent her home again. Dr. Breen was staying with family in Virginia when she died. If you or someone you know is struggling, please call the Suicide Prevention Hotline, 1-800-273-TALK.
Just a terrible loss, Natalie. In New Jersey, all major indicators are heading in the right direction. Hospital discharges are outpacing admissions. Still, the state is reporting 106 new deaths and over 2,000 new cases over the last 24 hours. Now, as Governor Murphy unveiled his roadmap to reopening statewide, parks in Jersey City reopened, but social distancing is not going away anytime soon. News 4's Brian Thompson is live in Jersey City with how things are going. Brian?
Yeah, Chuck, good evening to you. And it is a roadmap, but it does have speed limits. Governor Murphy not criticizing Jersey City's decision to open up 5 of its larger parks to passive recreation. But as you can see behind me here, they've set up a tent to distribute free masks to people who are out here, part of their effort to be responsible about this. Still, the governor refusing to put a date on when similar action will be allowed on a statewide basis.
The stay-at-home order, which has been in effect since March 21st, will remain in effect in its entirety until further notice.
Governor Murphy today with his roadmap to reopen, but not going as far as Jersey City today, which reopened some parks, promising constant sanitizing and enforcement of social distancing. A welcome move for this resident.
I walk all the way, when I have the time, through the park.
Mayor Steve Fulop.
We're starting with our larger parks where it's easy to social distance, and then over the next week to 2 weeks, we're planning on opening all the parks if this works out well.
With enforcement, the governor says he's okay with this local park reopening, but he's not ready to allow county and state parks to do the same, nor allow people to sit inside restaurants. Rather, when the time comes, only select businesses.
It's going to be the workplaces and other venues where we have a high degree of confidence that social distancing and other related norms can be effectively executed.
Protesters this weekend outside the governor's Monmouth County home, small with some 4,000 Facebook followers, but angry over the continuing shutdown, arguing it violates the Bill of Rights, arguing only the sick and most vulnerable should be quarantined.
We are ready and we are willing and we are able to take responsibility for ourselves in this situation. And he can open the state and let the businesses open.
But even Jersey City is being cautious. Active parts of its parks still closed. The governor's roadmap includes sustained reduction in new cases, doubling testing capacity, robust contact tracing, safe and free places for isolation of the sick, a cautious, responsible economic restart, and resiliency against future outbreaks.
Even if we bat 1,000, even if we get everything right, we will see cases.
Now, it's very interesting. The governor didn't mention it at his news conference, but late this afternoon he put out a release saying that he is going to open up certain things that we didn't expect. One, pet grooming businesses, pet daycare, pet boarding. That will be allowed. 2, you can go to a car dealer and test drive a car now. That wasn't allowed before. And hair. Now get this. Personal care business like nail and hair salons, they can open up for immediate family only, or within their own close thing, not for regular customers, but with also an added benefit at the end, somebody you're in a romantic relationship with who you may not be married to. That could be very confusing come tomorrow. Live in Jersey City, Brian Thompson, News 4 New York.
All right, interesting, Brian. At least you can take your pets in to get them groomed. We have some good news for you from Connecticut. The state just saw its 5th day of declines in hospitalizations. The death toll is still climbing, though, nearly 2,000 more. And more than 25,000 cases have been confirmed, 2,000 total dead statewide so far. But Governor Lamont says if the numbers continue to stabilize and decline, he could lay out a plan to reopen businesses soon.
We can maintain this declining hospitalization rate. That's the 2-week window that gives us at least some flexibilities for some early decision making there.
Well, some parks in Greenwich reopened today for walking only. The playgrounds there and other facilities are still closed.